respected parents and faculty, good morning to all of you. At the outset, I congratulate all the students and their proud parents for your children's academic achievement and also choosing medicine as your profession and joining the medical schools. Medicine is a noble profession. Once you become a doctor and once you go into the society tomorrow, people will look at you with great honor and also with respect. So from today, you are in this noble profession. At the outset, I like to mention a word about the parents' sacrifice. Dear students, remember that you are today sitting in this college, in this chairs, and enter into medical profession because of your parents' sacrifice. Your parents' sacrifice is unparalleled. They have sacrificed their energy, their time, and their finances to see you join in these colleges and wanted to become a future doctor. So don't forget their sacrifices. And always remember, if you remember your parents' sacrifices, you will never do any mistake during your career and look after them well when they need it. You are not a kid anymore, and at the same time, you are not an adult too. You are in a transition stage. This is the most important stage, a foundation stage, which is going to build you your career and future. This is the stage at the same time is a dangerous stage. You are not in a stage to decide. So this is the stage you need advice, you need a counseling, and you need a guidance. So some of the things what I feel is required for you, I want to share with you. The first and foremost thing you should learn is medicine education is entirely a different ballgame. Till now, you are in educational institutions where it is a teacher-centered. They teach you every point in the textbook and they teach you a guidance towards the competitive exams. There is a guidance on you. Now onwards, you are entering into a professional college which are student-centric. The teachers will not tell you now word by word. They teach you the concepts, they teach you the soft skills. You have to be proactive. You have to be proactive and use the faculty as a facilitators. They guide you, but they don't teach you each and everything. It is your duty and you have to be proactive to move forward in this medical education. So medical education is entirely a different type of education and it is very interesting. You are learning about your own body, you are learning about the diseases which are affecting the society, you are learning about the treatment protocols. What I am going to give is do not relax after joining the medical education. Once you join into the medical education, you will have two feelings. One is excitement, another one is anxiety. Excitement because you have reached into a medical profession, which is a noble profession, and anxiety because you don't know anything about the medical education, medical colleges, and how will be the faculty. Students, remember one thing, that the infrastructure of the colleges, the administration, as well as the faculty are all meant for you. The teacher is a parent outside the college. Take that feeling. So everybody is trying to shape you into a good shape so that tomorrow you will become a good doctor who is going to serve the society. So don't fear, don't have any anxiety things. And medicine is a wonderful and very interesting subject, and you can enjoy it. I'll watch you. You can every day you can feel happy and you can enjoy studying about your own bodies, studying about the diseases affecting our society and how these diseases are being treated medically and surgically. The third advice is attendance. You should maintain the discipline and regular attendance. You have to attend the college regularly. Even though the universities may say, for exam, 80% attendance is required, but I suggest you to have 100% attendance. This is particularly in clinical subjects where you can learn soft skills from your gurus. You should have 100% attendance. And maintain a good attire. Your dress will matter. Wear shoes and be clean and tidy. And once the people see you outside, they should recognize that this man or this girl is a medical student. Nowadays, we are seeing the students coming with the jeans, coming with the torn jeans, and coming with the chappals. That is not allowed in medical. There are certain standards set by our predecessors, and it is our duty to carry on that tradition and maintain the dignity of medical education. The next advice what I am going to give is about the internal assessment. Internal assessment is nowadays very important as far as the university rules is concerned. Never miss an exam and never fail in exam. These internal assessments cumulatively is going to help you in future. Suppose if you fail an exam, it will be bad feeling to your parents, your faculty, and also your confidence levels will go down. So never miss an internal assessments and don't take them lightly. Do well in internal assessments also. Think them they are the final exams and do well. The next advice is regarding friends and foundation. This is the stage where you make lot of friends. This is the time you have to pick and select your friends very choosily and very cautiously. Because of the NEET exams and the national pools, you may get people from different states, different cultures, different habits, different emotions. So choosing a friends may be difficult in the early stage, but as the time passes on, you will know who is good and who is bad. I will tell you, the friends you make in the beginning are not going to be the friends who are going to be with you till the end of your career. So choose the friends who have got a good academic outlook, a broad mind, an innovative mind, and those most important is those who have no addictions. Nowadays, the thing which is bothering the society is the addictions. It may start with a small sip of a drink, but it will go into a catastrophic events. So don't choose the people who have got bad habits. And it is always better for your future to have a good friends who can take along with you. The next advice I give you is be proactive in the classes. Ask questions. Questions is a two-way. You can stimulate the teacher. Who will teach the teachers? Nobody is going to teach the teachers. It is only the students. When you ask questions only, the teacher will clarify you, or if we don't know, we go and refer and we update ourselves. So questioning is a two-way. Always remember the Chinese proverb. If you ask a question, you will be considered as a fool for 5 minutes. But if you don't ask a question, you will remain as a fool for lifelong. So that is the importance of the questioning. Be active in the class, ask questions to your teachers, and learn from them. The next advice what you give is, some of your colleagues may tell that today we will skip the class. There is no need. The same subjects, there are so many lectures in the internet. There are so many books we can refer. But remember, Google will not replace the gurus. There are many ways of learning the subject outside the class. There are books, there are libraries, there are internet, there are seminars, there are workshops, but nobody can replace a guru. So you are going to encounter the doyens in their field, whether it is preclinical, paraclinical, or clinical subjects. One of the top teachers you may encounter in your medical colleges. So follow them, learn them, observe them closely. Each teacher, all may not be good in all aspects. Each teacher will have a good quality in them. Some of them may be good in timing. Some of them may be good in teaching. Some of them may be good in communication. Some of them may be good in emotional stability. So, learn the good qualities from all of them. You will become a complete successful person who will be useful to the society as a health professional tomorrow. So, my advice is, follow your gurus closely and never skip the classes. A Google will never replace a guru. That is what I believe. Next is goal setting. Set your goal bar high. So there is nothing wrong in setting your goals. Nowadays, the competition is very high. Unless you think and look 10 years ahead, you may not be in the race. So once you join, once you settle in the medical profession, set your goal, what you want it to be, where you want it to be, and what specialty you want to take, where you want it to be placed. So unless you set these goals, you are aimless. So set your goal early, set your goal high, and dream for it, have an action plan, and start early. The persons who start early will be successful. You take any story of a successful persons, they have started early in their career and they have done it perfectly with a plan. So do it at the earliest. Next and the most important is, your safety is a most priority. Only when we are alive, we can achieve something and we should be useful to the society. So out of our experience, out of the bad incidents, what we have seen in our career, I am telling you that be careful, take all precautions, whether you are at home, whether you are in the college, whether you have gone for any vacation, take care of your safety. We have seen students losing their life in road accidents, drowning, fire accidents, asphyxiation, and suicide. So, your safety is our priority and also your priority. Be safe, take all precautions. And one thing which I like to stress more is the positive path. You should always surrounded by positive feelings. You might have seen, you might have read many students taking their life out of peer pressures, out of the educational stress they are going through. So life is more important, more than the education and your profession. So only when we are alive, we can do something. So always you should surrounded by positive feelings. And the 5 qualities I believe what a student needs is intelligence, sharp alertness. You should know what is happening around you, what your colleagues are reading, what is their aim. Third is physical strength. Take good food, do exercises regularly, do yoga, do meditation, take care of your health. And fourth is emotional stability. And fifth is spiritual elevation. Whatever may be your religion, believe in something supernatural and do some prayer every day. And out of all the five things, intelligence, alertness, physical fitness, your spiritual elevation and emotional stability, I think the emotional stability will become the middle finger, which is the long finger. So emotional stability is very important. You should not be elated, you should not be depressed. So there is no word depression in educational phase and this young stage. So be emotionally stable, and your emotions are going to make you what you are in future. What I am going to tell you is your hobbies. Don't stop your hobbies. You may be good at art, you may be good at singing, you may be good at dancing. Continue your hobbies. Hobbies is one way of keeping you active, keeping you interactive with others, and participate in all the activities, whether it is in your college or in your university or nationally or internationally. That gives a keep you going. And the advice what I am going to give, a word of advice to the parents. Your job doesn't end now. You have sacrificed a lot to see your ward or your child in your son or daughter in medical profession. Now onwards also your guidance is needed. Be with your children. Monitor them, what they are doing, how they are studying. If you have any doubt, be in touch with the faculty. Second, the students. Give them the basic money which is needed for basic needs. Don't give too much money and spoil them. With these two advices to the parents, I end my advice to the students by saying that use the time, use the faculty, use the infrastructure available in your institution in a proper way, and come out of your medical education successfully with flying colors. Get a good name to your parents, get a good name to your institute, get a good name to the place from where you came, and also get a good name nationally and internationally. And always remember the word, work silently, let your success make the sound. You remember this word throughout your career. You should work silently, but your success should make the sound. Best of luck to all the students, and I again congratulate the parents for your unparalleled sacrifice to see your child in the medical field. All of you. Best of luck to all of you. Thank you.